You're listening to the Turn Autism Around podcast, episode number 232. Today, I have my good friend, Amanda Kelly, on the show. She is also known as Behavior Babe, and Dr. Kelly and I are going to discuss 3 big ethical mistakes behavior analysts make when working with families. And we actually spill over into 5 mistakes. And Dr. Kelly, just for those of you that don't know her, she's been on the show a few times before. She has her doctorate in behavior analysis from Simmons University and has worked as a paraprofessional, a teacher, school counselor, and behavior analyst in homes and school settings. And she has a new book out for behavior analysts all about ethics. So we are talking about ethics. And families definitely should listen as well, because we have a lot of things that can happen in your presence and ways for you to help behavior analysts and RBTs and paraprofessionals and school personnel get along better too. So hope you love it. Let's get to this important interview with Dr. Amanda Kelly. Okay, Amanda, thank you so much for joining us today. I know I had laryngitis for the first time since college. Then you had laryngitis the following week. So we've been trying to get you to come record for a couple of weeks now. So thanks for joining us today.
Absolutely. Thanks for having me. And I'm so glad we both have our voices back.
I know it was kind of scary. I don't realize how often we speak. Okay, so you have been on the show a few times, and we can link those in the show notes. So we got your whole fall into the autism world in, I think it was like way back, episode 8, I believe. One of my very first episodes. I know, more than 4 years ago. We're well over 1 million downloads now with our weekly shows. So you were here basically since the beginning. And you have a lot of ethical expertise, but just to catch our listeners up real quick, your 2-minute fall into the autism world and where you're at now.
Awesome. Thanks, Mary. I'll do it even shorter than that. It really started as a background in passion in teaching and education. I've always loved learning and teaching others what I learn and learning more from others. And when I was in my undergrad, I saw a flyer, met a child with autism, didn't know what autism was. They wrote ABA on the flyer, didn't know what that was. My professor didn't know. So, just cut to the chase, go meet the family, ask them, find out for yourself. And everything from there is just history. I decided once I graduated, I was going to pursue behavior analysis. I now have a doctorate in behavior analysis. But I think more importantly is how big and how small our community is. Over the years, I've had a chance to practice in West Virginia, Massachusetts, Hawaii, and now Florida. And I'm still in touch with that first family. And Mary, you recently got in touch with that first family, which is kind of cool as well.
Yeah, you posted something about the first little boy that you worked with, and the mom interjected. You were hiding his identity and everything. And the mom interjected and put a comment, "Oh, you can share his picture, no problem," and everything. And I clicked on her link to see, and she happens to live like in my county, probably about a 15-minute drive from me, so which is so funny. She didn't live there, until recently, but small world. So we might have Amanda come out this summer and reconnect with that first family and reconnect with me. So all good. So when did you become Behavior Babe, and how did that happen?
Well, it happened by accident, and here we are 15 plus years later. It was while I was working for a public school district in Massachusetts, and I was on IEPs. I was working in the school districts. I was supporting teams, doing some home and parent training, caregiver interactions, and I got injured and was out of work for several months. And during that time, nobody stepped in to take over the role that I was filling for those families and for those children. And teachers and parents started reaching out. And I was thrilled by that. I was like, oh my gosh, last year you wanted nothing to do with data collection, or you didn't want to hear about behavior analysis, or who's Amanda? And the following year, it's a teacher being like, I had this concern, I have this challenge, I created this data sheet. Will you take a look at it? Yes, Claire, I will definitely take a look at it. But turns out when you're on workman's comp, you can't do that. You can't be working while you're not supposed to be working. And so I figured out with one hand, it was a shoulder surgery, how to create a website. And I created a website with one hand and password protected that information. And basically, I didn't give anything to anybody that wasn't publicly available. You just had to have some password to get there. So I don't know how they found the password or how they got to the website, but once they were there, there was just freely available information. Needless to say, I didn't keep that position much longer. I finished out the school year in my medical care and decided to open the website and started asking people, is this valuable to you? Paraprofessionals, other teachers. I was working in schools still. And I remember some people being like, nobody will ever care. Nobody will ever look at this information. And I thought, well, it's a good distraction from my dissertation or my grad school. So I just kept doing it. And then in 2009, which was the following year, Twitter was like a coming to be, and we were going to conferences, and we wanted to post 140 characters about this great talk, this great presenter, Mary Barbera, turn autism around, hashtag. But we were like, got to keep your phone away. Don't let this presenter see you doing it. Obviously, that's changed a bit how we handle our phones in public spaces. But we had to have a name, and there was misbehavior, there was STEM function, there were some really cute ones and creative ones, and I thought they've all been taken. And that's not true. There was only about 3 behavior analytic names out there in the space. And so I went behavior woman, behavior girl, behavior person, behavior lady, behavior, and I was like, behavior babe, alliteration is my thing. So I put it in when I was in my, I'll go with my 20s, and here I am in my 40s, and it's stuck. So it's now a website, it's social media channels, podcast as well, and it's just I'm grateful for it because it's very memorable. My first website address was abama.webs.com, and I joke that really rolls off the tongue. No, it doesn't. So Behavior Babe, it sticks. It's memorable. That's me.
Cool. So it's behaviorbabe.com.
Behaviorbabe.com is the website. And you can email me at behaviorbabe@outlook. And if you want to find me online, it's just at behaviorbabe. So keeping it simple.
Yeah, I love that. Love that. I remember meeting you for the very first time in person, and we were at a conference. I don't know if it was 2009. It was after my first book. And you were standing by a poster about dissemination, and you had your little character icon, Behavior Babe. And I'm like, hey, wait, that's you.
Who's this Behavior Babe person? I was like, it's me. And I remember feeling so absolutely foolish being in a space using not a professional name or not being introduced. At the time, I didn't have my doctorate, but now Dr. Kelly. And I remember it was Judah. It was my friend, colleague, and mentor, Judah Axe, who first introduced me at a professional conference as Behavior Babe, and I just turned completely red. Now people meet me and they're like, oh, it's Amanda. Okay, hi, nice to meet you. And they go, oh, you might know her as Behavior Babe. And people go, oh, Behavior Babe. And I'm like, oh, okay. So she's definitely much more popular than I am. And that's okay.
Yeah. Love Judah Axe too. I should have him on the podcast. We should do that.
Oh.
Okay, so let's get to our topic of ethics. And so as behavior analysts, we know there's a lot of parents and other professionals listening. And if you are a professional, then you have to adhere to some ethical guidelines from somewhere. And we as behavior analysts need to adhere to the BACB ethical guidelines. But so you just are publishing a new book. Is it out yet?
The digital print is out, so it is available in PDF right now. I co-authored it with Emily Shrega and Lara Bollinger, and the published. Oh, I was going to say it's called Back to Basics: Ethics for Behavior Analysts. Okay. We really feel like it's just time to simplify these conversations. It's not about the cup of water or the cup of coffee. I'll explain that more if people need it. And really, just what does it mean to meaningfully, appropriately engage with the families, the clients that we serve? How can we do it ethically, but also still in a way that's effective and fun and relatable?
Okay. So it's out in the digital print. Is it coming out in a paperback or hardcover?
It is.
Yeah.
Yes, it's coming out in July. So it'll be available at the beginning of July. And it's written as a textbook, but it is also written in a way that I wanted to write something that I would put on my shelf after 20 years in the field. So it is not intended just for students. Hopefully, the more seasoned analysts as well will see themselves, their journey, their history, the different forms of their career, and some of the ethical scenarios that we put in the book. And we have over 50 that we explicitly included in the book.
50 case studies or
50 scenarios,
okay.
Dilemmas to walk through. Yes.
Okay. So how did you become get expertise in ethics?
It started just with a passion in behavior analysis. When I saw how effective the science could be, how effective the science is when implemented correctly, I just thought, wow, we should all do it. We all must know about it. We have to give this to every person who needs it, every family out there that wants to access it. Let's do it. But what good is it if it's low quality or if it's not ethical? And so when I was creating the website, everyone needs a little tagline, and mine was the disseminator for the ethical and accurate application and dissemination of behavior analysis. And I always wrote ethics in there. Maybe it was lingering from my grad school days. I'm not exactly sure, but I was like, this is important. And now I teach ethics for BACB University. I've been doing that for over a year. I worked on the ethics book itself. And really, I think some of it has just been putting myself in some pretty unique situations where I encounter things. I'm like, ooh, I don't know if anyone's been here before. And if so, they didn't leave me a roadmap. So it's definitely been a lot of what I call walking face first into spider webs. So on our book, the cover is a spider web, and we picked it because we say sometimes ethics or ethical dilemmas or problems they're translucent. You don't see them sometimes until you walk face first into them. And so we kind of use that imagery to explain how easily we could find ourselves in an ethical dilemma.
Yeah. Yeah. And I think there are, it also with ethical dilemmas, there's not usually one right and one wrong answer. It's not very black and white. A lot of times it's gray, and a lot of times you have to really analyze the situation to come up with, a couple options and then pick the best one. Like, it's not very clear cut. And over the years, because now it's 2 decades now since I've been a behavior analyst, and the ethical guidelines have definitely shifted and evolved. And sometimes in a good way, like you joked, which, I'm sure the parents out there don't know what you're saying when you're saying, it's not about a glass of water. And when I was a newer behavior analyst in homes and schools, at Christmas time and those sorts of, holidays, parents oftentimes gave the behavior analyst and the therapist presents. And we even brought our clients presents sometimes on their birthdays and that sort of thing. And then I don't know what year it was, but the ethical guidelines said no gifts, no exchanges of anything. And then some behavior analysts took that to be like, you can't even accept a glass of water or a cup of coffee in a client's home. So it kind of went too far. And now the 2022 guideline, what does it say about gifts now, Amanda? Do you know?
I do. It says gifts are acceptable under $10. And
Okay.
there's some cumulative parameters there. And that mimics what we see with Medicaid policies or insurance policies. So I think when we saw that the restrictiveness in our field was more restrictive than for medical professionals, and we are in the medical space, some of us, that there's a shift. There was a great publication by Ben Witz and colleagues, but it was like behavior analysts accept gifts. So what are we going to do about it? And they really called it out like there might be this parameter, but this is not necessarily practical, and it could disrepair relationships. And we need these relationships to have effective outcomes for our clients and the families we're working with. So what do you do when the ethical code conflicts with itself? I mean, you're right back to what you so succinctly described is it's a decision-making process. There isn't one right answer, except for a very few couple of things. You do need an explicit contract. You must maintain confidentiality. Okay, sure. But many things, it's all about triaging and problem solving. And so the problem that I find with any document in any field, any ethics code, is when it's read on the paper it's written in and taken for those words in black and white. It is a decision-making process that we have to do, which involves our histories, our mentors, our friends, and the clients that we're working with. So I think that the code itself is a huge improvement or evolution, I should say, from the first iteration. And I think that we always have space to grow. And as our field shifts, as society shifts as well. So for example, there was nothing about social media in the first version of the ethics code because social media didn't exist really when it was published. So there's other examples of things that will come up over time that need to be addressed explicitly. So I imagine we'll have future iterations, but this one just went into effect this year. So this is the current code and will be good for a bit.
Yeah, and you wrote a great article we can link in the show notes too on social media and ethics. And I think we talked about that on one of your episodes. So Amanda, your episode this time is 232. So marybarbera.com/232 will get you to all the show notes if you're listening on a podcast app. Okay, let's get into the 3 big ethical mistakes professionals make when working with families. So I know you spent some time thinking about this. And so what's your mistake number 1?
All right, mistake number 1. Let me start by saying that these are mistakes in other professions that other professionals could make, but I'm a behavior analyst and an educator by training. So I'm going to speak from that perspective, and I'm going to speak about the profession that I currently represent. I think it is really comes down to our language, the way in which we communicate. This could be the words we're using, like the word punishment. The word punishment in the field of behavior analysis means to decrease, literally means to decrease. But if we say to a parent like, oh, I'm going to put a punishment procedure in place, that doesn't translate well. And it's not exactly what we are actually trying to say. And ethically speaking, we would put reinforcement procedures in place first. But I wanted to pick something that has one definition to the rest of the world and a different one for us as analysts. Another thing that I see people doing is they will use the jargon words almost like real words and really do think because we've used them so much that they are real words. For example, manding comes from the word mand. It comes from demand, command, reprimand is my understanding there for Skinner's verbal behavior. But when we say to parents, oh, he was doing some great manding today, I don't know what that means necessarily, especially if I'm entering new into the services or into the relationship. Why don't we say things like, we're really going to find what motivates your child and help them get the words or the ways to get what they really want in their life. And today that went so well. By the way, we call that manding, if we even need to give them the language for it, which can be helpful when families want to search information on their own or look at any of the evidence that we might be finding. Okay, great, that's the term. But why are we talking like that? And why is it written that way in reports and treatment plans? I know from my own histories, Mary, I would write, behavior assessments, FBAs. And even when I put in the word antecedent into a professional report, I would put events that come before the behavior. So at least there's the definition and the context. Because if people can't understand what we're saying, then it doesn't matter how amazing the advice is that we have or the information that we could provide them. So I think the very first one is the jargon and the language. And I would add to that, it's also the way in which we deliver the information. So if we say to you like, oh, I'm going to find things that are really motivating to your child, and then you don't have a lot of confidence in what I'm saying because of how quietly I'm saying it or how unsure I am in saying it. So analysts out there who are listening, practice this. talk to people in your life, explain to them the procedures that you might work with a client on, and try to explain it without using behavior analytic terms. I remember when I was doing my graduate degree, we spent semesters learning how to be professionally precise and accurate, where I thought all I'm going to do is publish scientific studies at this point, because that's the only person. Even then, I don't even know if my colleagues would understand that level of jargon I was trained towards. And then I remember in the second to the last semester, they swung us back and wouldn't allow us to use any of the technical jargon. And everything had to be in everyday speech. And I remember getting frustrated. And I said, this is not fair. You just trained me to do this. And they say, that's great. We taught you to think like a scientist, but we need you to speak in a way so anyone could understand. And I'm just so grateful for that experience.
Yeah. I think because of my nursing background, actually, I feel like I'm particularly good at that, at translating, because the medical doctors would give, or the radiologist would give really scary kind of big language. And then I considered it my role as a nurse to, try to explain it in layman's terms. And when training individuals, my dissertation's on training, and I've always trained even new nurses. I was in charge of like staff development for a year or two. And it's like new people, whether they're parents or new professionals, they need it to make sense right away. And I feel like, my books are probably among the best in terms of really saying things in layman's terms, and even my courses, and the fact that parents and professionals are together in my courses and communities, we right away just dive into making it as simple as possible. And not just terms, acronyms. I feel like every time I have somebody on the show, a behavior analyst, for instance, a whole lot of acronyms get thrown out there. So I'm always like, I haven't had to do that with you, Amanda, because you're so good at it too. But like, okay, wait, BIP, FBA, ABA, IEP, just all these acronyms that we use that are overwhelming.
I was laughing and smiling as you're saying about these acronyms, and also about people who are learning the science or learning how to implement it, not just caregivers and parents, but professionals entering. I was bought in because I saw the effects. Then I went to school and was like, oh, okay, stimulus equivalent. Okay, cool. Oh, you mean that's what I did when he did that? Okay, got it. So it was really connecting it to experiences, connecting it to outcomes, and giving those names and labels. I do recognize that for some of my graduate students, they are entering directly into the program, maybe without some years of experience, or they're getting it simultaneously as they're in the program. And I'm teaching ethics. It's their first semester. And I have to remember, like, they're learning how to be graduate students. They're being nervous, I'm sure, about how to write research papers, how to look up things. And so a lot of what I do in that class is I don't throw terms at them, and I give them explanations and give them stories, and they go, oh yeah, and they're making some of those connections. But the acronyms came up, and they were like, why do we have so many? And I'm like, well, it's not just us. Like, we could certainly look at other professions, but it is profession specific speak, where, yeah, you have a VR and an FR schedule. I heard an analyst say to a parent, oh, he's doing really great, we're on an FR3. And I was like, you're on a what? I mean, I'm a behavior analyst. I'm a PhD level behavior analyst. And I was like, what? Like, I could break it down, use my brain, sit there, think about what that meant. Oh, fixed ratio. Oh, okay, every third response. Why don't you just say we're giving him his token after every third response? Like, that would be a little bit less to translate. Yeah. And I think the reason is because a lot of us as analysts, one, we're in sometimes echo chambers of other professionals. So we are speaking a lot to other professionals, and we get a little bit stuck in that way of speaking. And I think the other thing is maybe we just don't have the experience, and we're still working on that back and forth translation.
Yeah. I wrote an article published in 2007, The Experiences of Autism Mothers Who Become Behavior Analysts. And in there are a couple sections about, the novice to expert training model, as well as kind of on the job training like us parents get, or you got as a therapist for a little boy, and then going into it, it really does make a whole lot more sense, especially for us with experience. But we can link that in the show notes. It's a great article. It's kind of a classic. Now that the journal's out, they don't make the journal anymore. It was like the Journal of ABA and SLP or something like that. But anyway, it's a great article to think about training and on the job training and going into these technical terms. But moral of the story, we need to use language that not only the parents and the families are going to understand, but also the newer people and the multidisciplinary team, which is a whole nother, group of people who could be easily turned off by our jargon.
Absolutely. And I think it might be my education background that gave me a lot of experience with that. Working with, OTs, occupational therapists, physical therapists, speech and language providers, clinical psychologists, and many of those experiences were very positive and very collaborative. So and most people at the time didn't have a history with anybody who was a behavior analyst. So I didn't have to go in and build up or break down and rebuild. I just came in and tried to establish. And so, yeah, I really appreciate you mentioning that, because that's another place where if we are part of an interdisciplinary team, we get to have that practice and keep practicing using language people can understand, for sure.
Yeah. Okay. Mistake number 2.
Mistake number 2. This one starts with a personal story, and I originally had kind of titled it, "Be Wary of the Easy Yeses." But I think that actually is summarized by be cognizant of where you stand and other people's cultural histories, traditions, customs, norms, and experiences. So, for example, once I was working with a family and they wanted to expand their son's meal repertoire, the foods he was eating, right? Let's get beyond the beige diet. Had medical clearance, of course, made sure that that was appropriate and that we could be working on it behaviorally, and we were ready to do that. And so I had explained a bit about the, first then here's something that you don't love to eat, followed by something you might love to eat. And I was like, does that make sense? Did we got it? The mother stated it back to me, and she was like, yes, got it. Absolutely. Yes, we're definitely going to do that. Yes. And I remember feeling really accomplished. And by the way, this was at least 5 years post my PhD. So this was not an early career mistake. This was a not too long ago lesson that I am still holding on to and sharing. I remember leaving feeling successful, but also feeling like that was too easy. That was too easy. There's a lot of steps to this. I just asked her to change how she prepared meals in her house, and she has a household, not just her son, to care for. I don't know. And I remember thinking, I don't know about that. But you know what? She said, yes, everything's good. Let me go on to my next case. Let's get to the weekend. It's a lovely weekend. And when I went back to the home, which thankfully was just the following week, it wasn't a long time in between. I said, so how's it going? How did it go? Did you try it? What were your thoughts? And she says, Dr. Amanda, I have to tell you, I didn't do anything you said, and I feel bad, but I'm going to tell you now. And I was like, oh, gosh, that was my fault. That was my fault. Oh, and I did. And I love that she said, I didn't do it. How great that she felt comfortable enough, maybe not in the moment, but later to be like, I didn't do it. And then what she said was, I sort of did my own thing and it went horrible. And so now I would love to try your thing, but here are some of my concerns with it. And basically she had shared her histories and experiences growing up in a third world country. And you don't take food and take a bite and put the rest in the trash or put it in the fridge for later. That was not how her relationship or her family's relationship was with food. And I missed an opportunity to say, really, I guess, tell me what you normally prepare in the household. Or maybe I asked some of those questions, but I didn't realize oh, that's what you guys are going to eat for 5 days in a row. And so because that wasn't my history or my experience, I often ate a lot of food out of cans and in microwaves. I don't know if that was the 80s or being a military brat, but I didn't really have a lot of experience around that. And so to me, it's one thing to say, let's be mindful and aware of cultures, customs, traditions, I remember a family when I lived in Massachusetts who always wanted people to take their shoes off. And that felt very strange for a lot of our techs and people going into the home. And they didn't want bare feet and they didn't want socks. So we purchased for them house slippers that they could wear in the house that the family was comfortable keeping in the house. And we labeled people's slippers and here's your house slippers and you're not going to wear your shoes in their house. Then I moved to Hawaii and that would be like, that was just standard. Like, no, you're not walking into my house with your shoes on. And it would be almost unusual if you asked. To be like, read the room. Do you see the 500 pairs of shoes outside on the porch? Okay. So some of these things are a bit more obvious if we pause and just assess and we look. And some of them, that's why I felt like saying accepting a yes. If it's too easy, that should be an indicator for you. You might have missed something and you might need to ask more. And it might have to do with that person's at least history. Another thing that mom told me was, you're a doctor. Like, I don't disrespect or say no to somebody of higher authority. So I didn't feel like I could tell you no. And I, again, needing to be aware of that, I can't remove my doctorate, but very important to realize that some cultures will do what you say because of who you are, who says it. And that's not always in the best interest for the family or the child if they have another way that they really could be doing things in the family, in the household, that are much more effective and in line with their values.
Yeah. Yeah. I think you said a lot there in ethical mistake too. And I didn't, before I was a consultant, mostly in homes, starting in like 2000 and whatever year, but working with families in different cultures, it's like the shoes, even the little boy where we did take our shoes off and no one wore shoes in the house, he was having a problem because when he was potty training, he was taking his pants all the way off when he was sitting on the toilet, which, that's a problem, because then how are you going to get him independent and come out of a bathroom pulling himself up and washing his hands? Like, it was a problem, right? So my first, suggestion would be to have him wear shoes, because you can't really get your pants off easily if you've got shoes on. But I knew that their culture was such that shoes weren't allowed, but they could have, like you said, like slippers or something in the house. Like, it is more of a clean, dirty, bringing dirt in. At least it was for this family and this, whatever culture they were from. But so we managed to get like inside shoes that he could wear during the day so that it was, helpful. So that was a problem, that we overcame. Also, that same family, it wasn't abnormal for them to mush down all their food and to spoon feed their kids very late for our culture, and also to sleep in a family bed until
Co-sleeping.
age. So those were some of the differences that I was not familiar with. And also, it's not just culture, it can be race and religion too. I featured the woman who, Maria from, she was the founder of Autism in Black.
Yes.
And I can link that in the show notes, but she has some really good stories about, the African-American culture and their relationship with religion and intellectual disability and just all kinds of things that are great in that episode. So we just, and it could be a white family that lives down the street that has a different history of something or different preferences. And, I like that whole, not just taking the easy yes. And really, we're not just assessing the child and their strengths and needs. We're assessing the family, what's doable for the family, what's practical, and what's motivating for the family. Because if the family is not motivated to at least try it, it's not gonna be tried. It's not gonna be successful. So, I said this, I think on a recent show, I worked with a lot of times with the Verbal Behavior Project, we would be two behavior analysts, like a junior or a BCABA or somebody studying to become a BCBA, and then a BCBA like me. So I was also training behavior analysts, and And I remember some gung-ho behavior analysts in training that were like, okay, we're going to do this, and I'm like, you are on the bus by yourself. The bus has taken off. Like no one else knows what you're talking about. No one else is on board, literally on board with the bus that just pulled away. So you need to turn the bus around, calm down, and let's assess what's doable, what's motivating, not just about the kid. If you don't have the adults on board, it's not going to work.
That's a perfect segue into what I think is big mistake number 3.
Okay.
Which is asking too much, not understanding the perspective, and forgetting that we are there to make the family unit operate better. So meaning we're there to help. And if it's not helpful, then we have to adjust. So I think lots of mistakes I see in this area are those gung-ho professionals who are excited to help, who are eager, many of whom maybe recently graduated, and you want to save the world. That is an exciting thing. And that energy can be a bit much. When it's like, okay, listen, first thing I'd really like to do is I would just be able to get out of the house and it not take 4 hours. And I just need to be able to do that once a week. Okay, I see where you're at. Sometimes I think we lack that where are you at today question. And we don't realize the journey to get where we need to go. We're just like, okay, so he's going to be off of college and driving his own car. It's like, whoa. We're talking about a 2-year-old and mom just wants to get out of the house. So, actually, I'm kidding. Most analysts may not even be thinking 30 years ahead. Please do try to think that way too. More experience will give you that. But really, what is meaningful to the family? So the first question that I often will ask a family, and if anyone's ever asked you this, I think that's great. And if they haven't, maybe start thinking of this for the parents out there and say this when you have a new professional working with you. I always ask a parent, if I had $1 million and a magic wand, what's the first thing I could change for your family? And they'll tell me these really big, lofty, not impossible, but long-term goals, right? And I ask them, a magic wand and $1 million. I want your biggest long-term goal. I want to know what it is. And then I'll say, okay, what's number 2, 3, and 4 on the list? Like now just walk me down a little bit, just put them in order. And I have found asking the question in that way allows parents to say something that they may feel is not attainable or say something that they hope is attainable. Great, say it, because I want to know where you're at. And I want to know how to get you and your family there. But I'm never going to get you there because it's going to take a lot of hard work unless you can trust me, unless I can show you I can be effective. And until we have a relationship where we're willing to go like elbow deep together, if that's what it takes to get to that number 1 target. And what I find is we do often get there. Sometimes we make great progress and we don't always achieve exactly that $1 million magic wand goal. But we get there a lot of the times by saying, like, I can't tell people like, I need you to work with me and I promise I care about you. You have to show people that you care about them. They have to believe you. They have to see like, oh, now my son just tells me he points the fridge when he wants me to get his milk out. Okay, that's improvement. I see you're helping. Can you help me more? Okay, I'm willing to put more and invest in this. And not because parents aren't willing to invest, but I believe that they're always giving us their all. And if that is not enough, and I'm using air quotes, it has to be enough. And so as an analyst, it's how do you walk in and look and assess and see where the parents are at and meet them there and create relationships and change that will be meaningful. I see this in caregiver. I review a lot of treatment plans. I have that vantage point. And what I see in there is the caregiver will learn the 4 functions of behavior.
Oh,
The
God.
caregiver will deliver a token upon the second occurrence of the desired behavior within a 30-minute. It's like, stop it. How about this?
Now get off.
Yeah, just get off that bus. Get off the bus, turn it around, just get off that one, get on a new one. Get on one that has people on it. And just think like, we get where we're going by taking small steps. So take small steps. And a small step to a family is not a small step. It is a huge step, meaning that the effort that we're asking them to do, for example, I had a client once who would get aggressive and self-injurious if you told him no about a lollipop or going to the bowling alley. And he would ask these questions in the hundreds of times per day. Can I go to the bowling alley? Can I have a lollipop? And sometimes people would ignore it, and sometimes they would say no. If they said no, it would be an aggressive or self-injurious. If it said no, it would usually intensify. I'm simplifying the intervention for the purposes of this podcast, but one of the pieces of the intervention was to shift his language to when. When can I go to the bowling alley? When can I have a lollipop? And he started to understand time, X amount of sleeps, things on the calendar. We were able to give other pieces of information. You break it down. I can't get in his head, but perhaps he had some anxiety about when was he going to get to do his favorite things. He didn't know when they were going to happen. He's 5. How much control did he have over his life? So he asked. Well, to the parent, I wrote on a little flashcard, when, and I stuck it on their fridge. And I was with the conversation with the family. I didn't just do it and walk out of the house. Let me be clear. We were talking about this.
Just mess up your refrigerator with.
Yeah, let me just put pictures all over your house. No, not that either. But I said to her, she was saying, like, this is really helpful. This is actually working really well. But I forget to prompt him to say when. And I was like, cool, let's write it on a flashcard. How do you feel about throwing it up on your fridge? And she was like, got it. Come back the next time. And he was like, Miss Amanda, on Friday, I go to the bowling alley. Like, he didn't ask me. He told me when. And I was like, whoa. And she's like, now he can have 100 lollipops if he wants them, because he's not aggressive while he's asking. Obviously, she didn't give him 100 lollipops, but it was more of like, oh my gosh, it was just a win. And not WIN, but we all did win. But that simple strategy of like, okay, let's just throw it up here, because she was forgetting. I didn't say, oh, mom will remember to do this 6 out of 7 days with 100% adherence, or else we're going to cancel her support. No, it's like, okay, I am the one who has to adjust. I am the one who has to revise what I'm doing. Now, there is a point where parents say, yes, I'll do that. Yes, I'll do that. And no, they don't. And then we still have to really assess, like, what's the barrier and can we remove it so that we can provide effective care? So I don't mean that we shouldn't involve parents. I definitely, Mary, we're on the same page with that. Parents, get in as involved as you can. Your children are awake for 100+ hours, right, Mary? We know that, not 40 hours of therapy. That's right.
And so, if we can encourage parents and enable parents to be the captain of the ship, especially if you're in their home. You don't get to just go in there and just work with the child. It's the whole, everybody in the household. You have to pair with, you have to assess their needs and wants and desires and histories. You need to, get everybody on the same page, because intermittent reinforcement is so powerful. And if, I love the magic wand and $1 million. And I always say, if I give you $1,000 for your child to have a good day with no problem behaviors, or $1,000 for the hour, what would you have to do? And what you would have to do is you would have to raise the reinforcement super, super high and lower the demands super, super low. And then once you get into that state, then you inch by inch start increasing your demands and lowering your reinforcement. You have to do that for the child. You have to do that for the parent. If you see problem behaviors, that could be the mom crying, getting testy because you're not listening, whatever. The demands are too high and or reinforcement's too low. So you've already, and this is not to, make any behavior analysts or any professionals out there feel badly. We're making 1,000, 10,000 decisions a day. And it is it is a very fragile dance, especially when you're talking about different cultures, multiple kids, multiple languages, perhaps. It's hard. It's hard to be in there a lot of times by yourself, right? without a ton of experience. So I really do take my hat off to any professionals, especially that are going into homes or working with families, because it is so complex. The kids are so complex, and then you layer on the families, making it even more complex.
Yeah, I would, I know we're going to stop at 3, but I would add number 4 is that we forget that we can use the science of behavior analysis in all of our environments, And we forget that everybody around us needs to access reinforcement. And when that schedule, I guess it's another way to say it for the analysts out there, when that schedule is too thin for the families, you're going to lose them. And we're never going to get where we need to go without those incremental steps, just like you were saying, Mary.
Right.
And then I'm just gonna round it out. We're not even going to talk about it too much, but the 5th and final one, now I'm just doing 5, expecting perfection. You made me think of it when you said it's hard for the analyst. It is a lot to juggle and to challenge. And so a mistake would be expecting yourself to be perfect. A mistake would be to expect yourself to never enter into an ethical dilemma. A mistake would be to believe that you're always going to get it right.
Right.
You're
Or
not.
to beat yourself up for, forgetting that they eat, mushy food and they don't have this, or forgetting to take your shoes off or whatever. Don't beat yourself up. Like, let it roll off you. It's okay. You'll learn for next time. I mean, Amanda and I have made many, many mistakes along the way. And so we share them. Share your mistakes and talk about ethics in your school, in your organization, in your clinic, and even families listening. The behavior analyst needs 8 positives to every negative too. And the RBT, I hear families say, well, the RBT showed up, she didn't even have any experience. It's like, it's somebody that's showing up. If they are, willing to learn, bring them in, sit down, pair with them, sit down and show them what you've learned about table time with your own child. Teach them, well, it's not fair, they should become trained. That's just not the way the world is going to happen. So we all need to get along. Like, I'm looking for a person for Lucas right this second, Tuesday and Thursday. It's like, I'm not expecting somebody perfect to walk in. It's hard to find people that want to work, that want to show up, that have good clearances, good driving records. You know what I mean? Like, don't dismiss people because they're not perfect either. You know what I mean? Like, bring them in.
It's so valuable, Mary. I was a person who showed up at a house with no experience, and I'm Dr. Behavior Babe. So like, you really don't know, right, where that's going to go. And that doesn't mean that will be everybody's trajectory, but I really do appreciate you saying that for the listeners. And also, again, for the analysts out there, bring in the people who are coming into this field, welcome them, make them want to be here, make them want to stay, because the more that they're here, the more that they contribute, the more that they stay. Maybe a little bit less of that anxiety or stress the analysts might be carrying, or we can distribute that and kind of really create a more robust community and continue on that path. So at the end of the day, I will just say, well, actually, I already have said this. I said it's like walking into a spider web. One of the things I say is every new day I learn that every day a spider will rebuild its web, meaning every day there will be a new thing to potentially walk face first into. So just keep your eyes open, keep your heart open. And like you said, Mary, continue to have the conversations and talk about the mistakes, talk about the growth, and help others grow with you. That's really, I really appreciate coming on the show and having the opportunity to have this conversation, Mary.
Yeah. Well, I think that's a great way to wrap it up. I will ask you one final question, but before I do, all this talk about training others and being positive and 8 positives to every negative, I did a fantastic interview with Dr. Scott Geller a few weeks ago on the podcast, and Amanda connected us. He is an amazing guest. He has a lot of great resources. So check out his podcast. We can link that in the show notes as well. But I do think that using his, all of his positive energy with everybody will make our ethical dilemmas lessen. Okay. part of my podcast goals are not to just help the kids, but also help the parents and professionals. So what are your self-care or stress management tips for us to implement that you use?
Okay, well, I'm feeling really prepared for this question because I'm currently embodying these practices, which have not always been a part of my life. The thing that I do is I take a walk every single day. And for me, that has started after I lost the ability to walk. I actually had surgery, back surgery, the week of Christmas. And when I woke up, I was able to fully walk. And nothing like being able to lose the ability to do something to remind you how valuable it is. But for many of the families, it's just getting outside. If your day doesn't have sunshine, put sunshine in your day. For me, I joke that nature keeps rewarding me. Mary, yesterday I went on just a quick walk in my neighborhood, and I saw a white crane dive into the water and pull out two fish on its beak, two birds, one fish, or two fish, one bird. And I thought, wow, that is so cool. And I would have never seen that on my couch or in my kitchen. So step outside, doesn't even have to be a walk, just step outside and put yourself in the sunshine. I find that when things are confusing or overwhelming or too complicated for me, I observe nature and I find a lot of lessons there, and it really simplifies the thoughts in my head. And so those are my strategies.
Nice. And you have made such a miraculous recovery. I was really, really worried about you when you were posting, and you even use a wheelchair and airport
Yeah.
travel. You were in so much pain. And yet you always, every day for years now, you have posted a gratitude on your Facebook wall, which is amazing as well. So that's another self-care tip that, in addition to walking, is such a thing that you're modeling for all of us. It's really fun to see that.
I honestly forgot about that, Mary, because it's now just a part of my fiber and fabric and being. So that was a recommendation from Scott Geller
How
on
was it?
it's like the habits of happy people and things like that. And one is gratitude journaling. And I think it's write down 3 things you're grateful for every day. I just do one. And some days there's 100 things. But when I was in the midst of the absolute worst pain, it was wonderful that it was a habit I had already had in my repertoire, or I was already doing, because there were days where the only thing that I felt grateful for was like the smell of coffee or the cold floor on my feet. And it really pushes you through some really dark times. So I know that families and providers end up in places where we carry a lot of the stress and the burden and the responsibility. And so, yeah, gratitude journaling, it's just become who I am now. Thanks for pointing that out,
And you
Mary.
publicly post something, which is nice. And so, yeah, so I do think that even when you were in pain and really struggling, you were still practicing that daily gratitude, which is amazing. So I'm so thankful that you're now feeling so much better and walking and enjoying life again. I can't wait to meet you in person again sometime soon, hopefully this summer. Thank you so much for joining us today and sharing some ethical dilemmas with us. And we will post a link to your book too, Back
Thanks.
to Basics, all about ethics for behavior analysts. So I'm excited to read it myself. Thanks again.
Thanks, Mary.
If you're a parent or professional and have listened to this whole podcast episode, and perhaps many of the podcast episodes, I am here to tell you that your next best step is to most likely join our online course and community. We have a course now for toddlers and preschoolers. We also have a course to help older school-age children who are still struggling with talking, tantrums, picky eating, sleeping, potty training, and so much more. The courses have very similar modules, very similar themes, but different case studies, different examples, different success stories. It is 60 days access. In 8 weeks, you can literally turn things around for your family or at your school in homes helping families. Either way, it's an amazing community filled with parents and professionals from over 100 countries. I hope you check out all the details at marybarbera.com/courses, and I hope to see your introduction in our community today.